to eat as well.
Yeah, so how was the results? Is it any
Doesn't seem to be any signs of anything specific.
So the most common thing that you would eat and then quickly after get more sick without diabetes would be food poisoning, and that's a toxin, and we don't usually detect that in a person. They get better quickly as well. So that's likely what it is. So we would expect the results to be normal from that point of view. So that's no doubt the last straw that made you really sick. But of course, before that was the diabetes. So we've talked to you a bit about your diabetes since you've been in hospital. And I think in the past you saw one of my colleagues back about 4 years ago about your diabetes. Do you understand about your diabetes now? Yeah. So you have a less common sort of diabetes where your body is slowly, it has destroyed your pancreas, so it cannot make its own insulin. This is the less common sort. It's a bit like the diabetes that children get, but coming later in your life and sort of slower. So they get it like their pancreas, the gland making insulin, goes and this goes, falls off a cliff. Yours is later in your life and then slowly gets worse and worse and worse. And even when we knew that in 2016, or even if we were 10 years earlier in 2006, if we could have seen the future for this, we could never have changed it. Okay? It is a sort of diabetes where there is nothing about your lifestyle, there is nothing about good things you have done in your life, bad things you've done in your life, whatever, there's nothing that changes it. Okay? And it's very important you understand that, because the commonest diabetes, type 2 diabetes, often the messages are about eating healthily and exercising and keeping the weight off, and you will keep free of diabetes or less chance of diabetes. For your sort of diabetes, that is not true. There's nothing you can do to prevent it, and all of the effort is about treating it properly with insulin, because that's the missing ingredient in your body.
So it's dealing with it rather than trying to say that, because I think that's also communication with our people is type 1, you can't reverse it, but you can deal with it.
Absolutely, that's right, yeah.
Because I think that line there it's just confused for them.
I agree, and so I actually make a special point, just to clarify what you've said and agree with you, is when I see, in particular, I'll just give an example, I see a 20-year-old Samoan girl or boy, young man, I make it very clear to them that their diabetes is not the same as maybe their grandfather has, who got it when he was, say, 60, and that the things that people will say to try and help them won't necessarily be true for this person with what we call type 1 diabetes. And yours is a sort of like late and slow version of type 1. Okay, we call it LADA, and LADA, the letters just mean it's autoimmune, that's type 1, latent, which means sort of hidden originally, diabetes in adulthood, coming on when you're older. So it's a lot of words, but basically it's like type 1 that has come on slowly and late in your life. That's all. Okay? So instead of being when you were 15, it came on when you were 20 something or whatever. Okay? But it is irreversible. And that's hard news. A lot of people go, that's worse, but actually it's not worse. It just pushes all of the effort into how to manage it. And not a discussion about, did I do something wrong, or should I be ashamed about it, or anything. None of that is not even relevant. It is to be put aside. And as soon as one gets to the mindset of saying this is about how to manage it, then you do what you do for managing anything else. You bring people to you to help you, your family, so they can help understand and make sure they know what to do if they find you sick. Okay? The health professionals to help for their expertise, for being able to solve the problems. Okay. I'm going to ask you, did you used to play sport when you were younger in a team, like netball or something? What did you play? Netball? Soccer. Okay. So I want you to think a bit about managing your diabetes like when you used to play soccer. Okay. You had a goal in sight to get a goal, literally, okay, or defend your own goal. And you had team members that worked with you, and then you had team members that were like on the field with you, people you passed the ball to, for example. And then you had a wider team. The wider team included your family, helping you get to the game, maybe, okay, helping wash your uniform, making sure you had the right breakfast before you went out to play your game that day, picking you up for practice after school or whenever it might have been. And you also had your coach, okay? And maybe you also read books, and maybe you were inspired by looking at some very good players, okay, or maybe on TV or some team or something that you looked at. And our part in this is a bit like your coach when you played soccer, okay? The coach is a person who you respect, and you know that the coach is not there just to hold the cup with you when you win, or to clap you the days you win. They are there when you don't win. In fact, they are most helpful for you when things are not going right. They're helping you for preparing the skills. You are not fit. You've come back from summer holidays not fit. You need to do fitness training, and you respect why they tell you that. They're not saying you're a bad person. They're just telling you what you want to, you need to achieve to play a good game of soccer, for example. And the coach is also the person who, when they see things not going well on the thing at halftime, says, I'm going to need to sub you out, or I need you to move position, or we need to change the formation from this approach to that approach, because this approach is not working on this occasion against the other team. And so for diabetes, the equivalents for that are us sometimes changing the sort of insulin, and for us saying we need you to do more testing, because the testing of your glucose is a way we can see how the play is unfolding, okay?
Yeah.
Otherwise it's like, what's happening? Sometimes it's good, sometimes it's bad. We sort of like, we need more detail to understand what's happening. And doing those tests, of course, are useful to you in real time, how I manage it right now, but it's useful then when we meet you, we can see, we can see what's going on here. If we change this here, do that a bit more there, this will fit you better for your life, okay? And so we're a coach. And the bad thing about being a coach is that you spend, even though you love the soccer game and you love your team members and you're doing it for them often, in your own time and things, the bad thing for a coach is they spend most of their time telling people to do better, or don't do this, or do more of that. Most of it is, we can call it negative, like you're saying you're not doing enough practice, or you're not kicking the ball fast or accurate or whatever. And we are a bit the same. We spend a lot of our time saying you need to take more of this, or too much of that, or we need to change some approach. But actually all of it is to get victory, okay? And of course we want to celebrate and say, HbA1c, that sugar test, 100, now it's down at 65. That is a huge improvement. We want to celebrate that with you, but to celebrate it we have to change things and help you. Okay, so you understand where we come from? We're never saying it is bad, we're never saying you are bad, we're never saying it's shameful or anything. We're only saying what would make it better. Now in all of this, we're actually in a lucky time, because, and registrars hear me say this, this year is 99 years, next year will be 100 years since insulin first got manufactured to be used for people. And originally it wasn't the insulin we have today, it was much more primitive than that, but it was the beginning of changing people's lives who had type 1 diabetes or LADA that you have. And so we are living in the best time in all of humanity's time. This is the best time to be in. And also we have good things like testing and good laboratory tests that can help, sort of finger pricks and going to the lab, that can help us or guide us to give you good treatment options. Okay. So all of those are good things, and yet it's hard for you, okay? Every day you have to live with it. Every day it is one extra thing or two extra things you have to do compared with maybe your brother, I'm going to guess he does not have diabetes, or me, I don't have diabetes, to do, and that is hard. But once we accept that, and then we say, so how will I manage it?
Honesty.
Yeah, that's right, yeah, because you cannot deceive.
No, she's got to be honest to herself and accept it. Which is the hardest thing for us sometimes, is to accept that man, I've got a diabetes.
Mm.
You know, because sometimes, you know, look at the family, why it's happened to me but not that person, you know. And I think that's...
I know exactly that feeling, because it's one that a lot of people have in different fields of their life, and they say, but I played the rules right, why did this happen?
Yeah.
And as humans, all of us are naturally questioning. We look for answers, okay? And sometimes there isn't an answer, okay? You know, there isn't an answer of because of something I did. There sometimes is the answer of because this stuff happens, you know, like why did the earthquake come, or why did the tsunami hit Samoa, or something or other.
Yeah.
There is not an answer to that. We cannot look to the universe for the answer. So, but what we must do is support the people who suffer from that problem,
Yeah.
or rebuild their lives or whatever. And that's the same thing as we must do for you. Okay. So look, you're going to be well to go home today, which is of course the good news, eh? Yeah. And what I'd like to offer you is that our service can help you in coming to clinics and teach you about things to do with diabetes. We'll sort of start from scratch and say, we're not insulting you, but let's not assume that you understand the type 1 sort of thing much, okay? For example, when I look at your food here, that is a food that others have bought you and you choose to have. We want to teach you how, when you look at that food, you can work out how much insulin you should have when you decide to have the banana chips or the grapes instead of the vegetables and things there, because we can teach you those skills so that you can make a good choice for your insulin. Okay.
I didn't bought any of these.
No. And I'm not.
No. I'm just saying.
Yeah,
I'm just saying.
no.
I'm just joking.
Yeah. So we can help you with all of that, so that you can live well with all of this. Okay. And we can also, when you come to clinic, you can bring along anyone else you want, a partner, family, brother, other family member. Maybe you've got children, I don't know, who might want to know how can they be helpful. What should they know that will help you? Okay. And that means help you for when you sit down to have dinner tonight or tomorrow night, that your family members that you have dinner with will say, as I'm going to guess, we don't only just say grace before we have dinner, we say sister, partner, mum, whoever you are to them, have you had done your finger prick test and had your insulin yet? We are just waiting here, ready, the dinner is here, but we're going to wait until it is done. And they will support you by doing that. That'll suddenly make it easy to remember. Okay? Because I bet that's not what you've been doing to date, is it?
No.
No. So we can make it easy.
It is hard to sometimes it is hard to discuss those things on the table.
Of course.
But I think it's just being normalized in the routine that she's gotta have to be this is,
and soon it will become
lifestyle.
It'll become automatic. It is as automatic as washing your hands, or as automatic as this year it has been keeping distance from people, wearing a mask if you need be, use a COVID tracer, whatever. We just go, this is what we now need to do to be healthy and stay healthy and well. Okay, so, and others can help you with that. Do you have children? How old?
The older one, 20
20, yeah.
and 12.
And are they living at home with you?
Just one.
The 12-year-old one? Yeah. So tell you what, 12-year-olds are really good at making sure you follow rules. So the 12-year-old can say,
tell me about it.
Mum, it is time for, have you had your insulin yet? Because we're all keen to have meals and we want you to be well.
Maybe we need to get Maddie and Hope to live up here.
Okay. So you decide who comes along, of course. I'm just giving you an example, but utilize us when you come to the clinics to help give other people information that can help as well.
How many, I've got to ask, how many community or outside in South Auckland that get this information, what you just told, that gets out?
Yeah, so in short answer, I don't know. Believe it or not, 15 years ago, or 15 years ago, we had a very large program of outreach. So for example, we did work with all of the Pacific churches.
Yeah.
Some of that still continues, but it's what we call largely just self-perpetuating. We don't feed it so much as we used to feed as an information. We worked with the marae. We worked with the schools. At the moment, we work with all the GPs, and of course, the belief is that GPs, and there's 700 of them in South Auckland, over 105 practices, that the GPs are your community version of all medical knowledge. We call it the home of the person's health
yeah.
and medicine and things. But the truth is, especially for type 1 diabetes, is many practices only maybe have 2 or 3 patients who have type 1, so they're not very experienced. They don't have enough knowledge to help with all the questions a person might bring to a clinic. And so it remains one of those things for type 1, not so much type 2, where people need to come into one of our hospital clinics. Now, our hospital clinics are not here, they're at Mangere, they're in Otara, they're in Botany, they're at Manukau Super Clinic, they're at Pukekohe. So we have all of those places we do some clinics at. And sometimes we believe that people will find it more convenient near their house. Actually, sometimes it's not true because they work somewhere else and it's not more convenient at all. Or sometimes they say, I get on with that particular doctor or nurse, and if I can only see him or her at Botany, even though I live, I'll just say at Otara, well, that's 5 more minutes drive than this other place, but I would prefer that for a few times a year to go. So we have those options. So we are present in quite a few places. We give information on an everyday basis to any GP that wants information, either please see my patient, come to the clinic, or I'm struggling with this part, can you give me some advice? And we type it back to them, or write them, talk down a phone to write a letter to them, or sometimes just talk to them on the phone. Anthony here and the other registrar frequently take phone calls from people, from doctors and things. So we do all of those things, and of course, most importantly is when we meet you face to face, because that's where we look at your face and we see that you are a little bit confused or a bit upset, and we ask you what's going on in your mind, and we ask some questions and help you with the understanding. Okay? So we do all of those things. What do you think?
Oh, good.
All good. Yeah? Are you feeling a bit more positive about it? While you are here in hospital, is there any other people that we should meet while you're here and have a bit of a chat about it? No? What about that 12-year-old or 20-year-old?
She knows I've got diabetes, and she, like, I just told my brother that if I'm got low, she's always helping me for giving me what I want.
And I bet if
And
she's...
the only thing why I'm here, because I miss out my insulin.
Yeah, I understand that. Yeah. And there'll be reasons for it, and it's, you know, it just makes the proof, as we've said, that the type of diabetes you have is that your body doesn't make its own insulin. And we're really fortunate that we've got insulin. And we're also fortunate we're in a country where you get it for pretty much for free, because I'll tell you what, there's some countries, typically poor countries, where you don't get it for free. So there's some good in all of that, but it's helping you. So I'm just guessing that your 12-year-old daughter, who's been really helpful when you have lows, would love us to be able to help you prevent those lows. And that's by teaching you some more skills for your diabetes. And it's not about type 2 and preventing it, it's about type 1 and adjusting the insulin for what you're eating and what your sugar levels are. Okay? And it's pretty simple mathematics, but it is mathematics, can't pretend otherwise. It's teaching you, for example, and I'm just picking it because I can see a label, but so banana chips, it actually, the information has been made that the companies have to put it on there so that you can go, when I have this much, and we'll teach you what an apple is or whatever, that is this much carbohydrate, and that means I need this much insulin. Okay, we'll teach you those things. Okay, good thing to know.
It is a good thing to know information, because this is my passion, is to be able to help this, to not prevent, but also now understanding that the type 1 is actually reversible, in our community. So me and my wife, own a gym in Otahu.
I got the impression you might,
and just working through, just getting information, what you just said about that, much insulin and also the carbs and all that sort of things.
Yeah.
But more importantly is how emotionally to deal with that
Emotion is a
emotion.
big part of it.
Mm.
Learning to live with it.
Yeah.
And and it's interesting this year to think about that with the COVID, isn't it? That everyone in the community has had to learn to live differently in various ways. Some people have to work from home. Some people have lost their job. Some people, like we, have come to work but have to wear masks. Not right now, but for a lot of time we were. Some people have had to line up for a supermarket. Some people have had, a whole lot of things changed. If you were wanting to travel to the Pacific, you can't. It wasn't long ago they said maybe we should open the bubble to the Pacific, and then suddenly we had cases back here in
Close,
Auckland. Close that possibility off again. So we've learnt actually that the way to manage health problems, especially when they are common in the community, and obviously for Pacific people, type 2 is very common in the community. Near 50% of 60-year-old Samoans have type 2
Type 2.
diabetes. It's that common. Is, as an example, much fewer in young people, but is that we have to learn different ways of living if we are going to manage this well. Okay, and that's about fitness, it's about nutrition, it's about various other forms of protection and keeping well. Type 1's different, the challenge is different, it's much rarer.
Yeah.
Okay. And so separating those two is very important. We
It
can still do
is.
the same testing.
It is. Because what I'm seeing in our community, oh, you've got diabetes. You can take this medication. You should do this diet. It should be fine. You can reverse that. But understanding is, hang on, what type? Type 1 or type 2? Hang on, you can't, so it's just those, basic stuff that they need to know. And I'm, pleased to be here and be able to listen to both of you sharing, to taking that information back.
And I'm sure you'll be able to support your sister in various ways.
Yeah,
and
definitely.
helping her with that.
If she allowed me to.
What do you reckon? Are you going to let this guy help you? Okay, so probably get you home today. Now you're going to need more insulin, aren't you?